avian. So this is very common nowadays among young adults, especially the males after COVID area. COVID time ke baad this avian avascular necrosis has increased. Basically what it is infection in the pelvic region. Like you can see edema in that region. Infection means water accumulation there. People are unable to take their legs apart, like while doing exercises, how we take our legs apart, that was not possible. So basically males while driving their two wheelers were not able to take their legs on the other side through this thing. So can you see the patient how he is walking? I have drawn a line on the shoulder region. This patient is 32 years and is having lumbar scoliosis. Okay, lumbar spondylitis is very common, in which lower back pain is there. Okay, but slowly and gradually the patient developed scoliosis also while sitting for a longer duration, because his office hours were like 10-12 hours. So he sat for a longer duration, and gradually there is a disruption in his shoulder level. So while walking also he was limping forward, and he has to wear a belt. Can you see the belt also? In the third smaller photograph you can see he's wearing a belt to keep his body straight, because he was unable to walk straight. This has also created problem in his knees, and his walk was disrupted. He felt that his body was tilted towards one side. In the x-ray, as you can see his hip region, I have drawn a line as to show that his right hip was so higher and his left hip was so down. There was a disbalance in his body. After treatment, 22 days properly treatment ke baad, can you see the difference in his shoulder level? It came to a level, and it is also visualized in his x-ray. Post x-ray, can you see the level of hips has coming to a one position? Slowly and gradually, if you do exercises, keep your body straight, the alignment of your spine can also come straight. He was unable to stand, walk properly. Standing, walking, taking steps was a very difficult aspect for him. But after the treatment, post treatment, he was perfectly fine. He could walk for half an hour to 45 minutes with a faster pace, which was actually a miracle to his family members. They were literally like, and his level of happiness was unbelievable. Okay, so this is osteoarthritis, as we commonly see in patients after the age of 50, 55, 60. This arthritis is increasing day by day in all the patients. So one patient who was age 69 years, see, I have taken two patients which of the age, in sense like we put the pressures on the patient. So aged patients were also able to take the pressures and could show the difference in their x-rays. Can you see the first x-ray, in which completely there was no space? Okay, the inner portion, can you see there is no space. I have put a red circle around that area. There was no space between the femur and the lower bones. Okay, tibia and fibula, there was no space. But in the second one, can you see there is started space in between. There is a gap little between both the knees, in the knee joint. Can you see it? So this is improved area. Okay, so this treatment was done for around 20 to 25 days in first phase, and then the patient was called in the second phase also. So but we didn't go for the x-rays after that, because taking x-rays again and again is harmful. So this was the only pattern we can tell everybody that yes, it has started improving. And of course the patient can see with their walks, number of times they can climb the stairs, the long they can stand, the longer they can walk. This is the way it can be seen by the patient also. Avian. So this is very common nowadays among young adults, especially the males after COVID area. COVID time ke baad this avian avascular necrosis has increased. Basically what it is infection in the pelvic region. Like you can see edema in that region. Infection means water accumulation there. People are unable to take their legs apart, like while doing exercises, how we take our legs apart, that was not possible. So basically males while driving their two-wheelers were not able to take their legs on the other side through this thing. So we had a patient of 26 years old. Just imagine a 26 years old. He had a severe COVID. So after that, he came to us with this problem, avian hip joint area. And after 22 days of treatment, he was able to walk for half an hour, was able to do all his activities, do his exercises, which we told slowly and gradually increase it. But as you can already see in the first one, the pre-treatment, it was totally jammed. Okay, see the coloration of the x-ray, and in the other one you can see that it's a little bit gap in. So this gradually increases with exercise also, with the treatment part also, because the infection slowly reduces and the bone slowly and steadily becomes little stiffer.
Nandlal, please, can you ask?
My name is Nandlal Kothari. I am calling from Rishikesh.
Okay.
I would like to skeletal pain management.
Yes, sir.
I have a chronic illness in which my L5S1 disc has been, it has been reduced by 12 to 15 mm to 3 mm. The size or the thickness of the disc has been reduced, which is giving me a chronic continuous pain on, especially burning sensation right from my buttocks radiating towards my leg.
Okay.
I have been taking a treatment for now almost 1.5 years. I have also gone through the surgery, as they said that there was a herniated disc and they need to remove that part which is pinching the nerve. So right now, in my lower back, I always feel a stiffness. It is a kind of pain with the stiffness, and it's radiating through my buttocks, and my legs are very heavy. So whenever I'm walking, it feels like I'm walking with double of my weight. So is there any treatment in Siddha?
Yes, sir,
I
definitely
can
there is treatment at Chakrasiddh we can provide you. See, we get many patients who have already gone through surgery, especially L4, L5, L5S1, because that's the area which actually generates pain in the lower back issue as well as to complete leg. Okay, so we provide treatment, but for that you will have to stay at least minimum 15 to 18 days in Hyderabad, because center is in Hyderabad. We do provide treatment for that. Okay, so the same pressure therapy will be given to you. Your diet will be modified. We'll tell you some exercise. We have physiotherapists who will particularly tell you all the exercises along with the treatment part of it. Okay, the thing is, in the surgical part, we will not touch that area, but around that area where you feel stiffness, because that stiffness is felt throughout your leg. You feel the bulginess in your leg, heaviness in your thighs, as well as in your calf muscle region. Okay, so we will treat. The treatment is possible, but
the question was that the disc, which has been considerably or significantly reduced to 3 mm, which is according to the physiotherapist, or I have been with the chiropractor and also the doctor. They said that because of the cushioned area is significantly reduced, and that is the reason it is causing pain and it is pinching the nerve. So how this could be benefited from Siddha medicine?
So that's what we have, a manipulative system, as I already mentioned. With the pressures, we will create that area, that cushioning ka jo area hota hai, we will provide that space between both the L5 and S1. Okay, we see already the area has been operated. So less pressure will be provided in that area, but the other areas which are also causing you pain and throughout your leg area will be recovered. You don't have to worry, sir. All the movements, all the walking and all will be provided by Siddha. You don't have to, in fact, you can see the changes, because we tell you to see after 3-4 days only that what changes do you feel. Is there any flexibility increase? Is there any pain decrease in there? We continuously monitor you for throughout days you will be spending over there. And without any medications. We won't give you any medications, but with the treatment, with the pressure therapy that will be provided throughout your leg, will give you more ease and flexibility as well as in pain.
Okay, so you said that minimum 2 weeks up to 3 weeks.
Yes, sir. That you have to stay because the center is in Hyderabad only. Dr. Sindhuja is there and the team works on you. There is Dr. Shankar is also there. Both of them treats the people. They see you once or twice throughout the whole sessions. I mean, throughout 15, 20 days, whatever you stay, 3 weeks ka time period. And you can see the difference in your pre-X-rays and post-X-rays as we already seen in the slides. That way we will show you. And moreover, you can see in your quality of life. Like earlier, like if you are walking, not able to walk properly for even 10 minutes, after the session, how much time period you are walking? That means there is some difference in your body, okay, which was causing you harm earlier. But now that if you are able to walk a little bit, running, bending, so all those symptoms, if they are reduced, that means it's a betterment in your body.
Got you.
Shmel saying that would you recommend Siddha to other governments to implement it?
Thanks for such a lovely question, because see, Siddha is a way of living and we want everyone throughout the world to go through this Siddha treatment, to give a chance to your body, as I already mentioned. And we want all the governments, we ourselves want, to approach. In fact, Dr. Sindhuja is taking few of their patients from US also. She had gone to US and done the treatment over there also. People from US, UK, they definitely travel to India, to Hyderabad to take the treatments. As we have already seen one patient I told you about US, she had lymphedema. We want to actually approach other governments also, but that can all happen through governments. We take this into serious issues, and it's actually good for all the people to take such kind of treatments, without harming your body, without taking medications. Such good treatments are available that it's a miracle to everyone.
Are they, like, you have medical colleges?
Yes, we have, ma'am. We have in Tamil Nadu several Siddha colleges are there which are providing Siddha medications. So there are two concepts, one, people who are coming out from the Siddha medical colleges as Siddha practitioners. One is the practitioners who have taken it from generations. Like Dr. Sindhuja is from generations. She is the 36th generation who is continuing this Siddha medication. So it's a tradition from her own family. Okay, so we have doctors who are from Siddha background working in our institute at Chakrasit, but she herself is a traditional based Siddha practitioner. So what they say is people who are born into some kind of stars can only take that much of magical into their hands. So she's among those people.
Are there other such institutes across the country?
Yeah, there are many, especially in Tamil Nadu, people go for Siddha a lot. So we have many colleges, many institutes, many private hospitals also for Siddha over there.